So Dr. Watts is
Yes.
back. So
Yeah.
Dr. Watts, I know you're quite busy. So at this point, but let me ask you the similar questions I asked Dr. Coleman in terms of, you interview students, you've seen all the IMGs, and you see what programs are looking for in the IMGs when it comes to the US clinical experience, telerotations. So give us some insights into what you think in the coming season or seasons program directors will focus on when it comes to the foreign medical graduates in terms of their skills, experience, education.
So because of the pandemic, and Dr. Coleman may have touched on this, I know for sure at our institution, all of our interviews are virtual, and I believe that is the case across the country. I believe that all of the interviews are going to be virtual. I don't think there are going to be any in-person interviews happening, and because of that, one of the main so the things that we usually glean from an interview, right? We're trying to get to know, get a sense of the candidate, to get a sense of their, of course, presentation skills, so how they present themselves, what their personality is, if they are someone that we want to work with, basically. So the same sort of focus. I mean, I do think that, of course, the applicant's profile is going to be looked at for sure, right? So definitely the personal statement is going to be one of it's always, and now it's going to even have to carry an even heavier load, is going to be one of the main things that we look at. We want to get a sense of the candidate from the personal statement, and then in the interview, which we also is aware is going to be virtual, that is something we're going to have to garner basically from those main aspects. So that's going to be one of the biggest things. And we would rely pretty heavily on the interaction of the candidate as they present themselves at the actual interview, but we recognize now we're going to have to tune up our assessment skills from a virtual standpoint, apparently. So that's going to be one of the biggest things, and with that is again going to be the candidate's ability to present themselves. So communication is going to be key, right? Their ability to communicate why they want to be at this program, why they want this particular discipline, basically things that they should be able to communicate regardless of what rotations or how they have rotated in an environment. Often the students are very comfortable with thinking that, they know a case or they know how to manage, but you should be able to walk and talk through a case and how you would approach the patient, because that is also what you're doing as a senior resident, as an attending, right? You're getting phone calls from residents who are your eyes and ears in the hospital, asking for guidance or agreement on the patients that they're seeing. So they should be able to demonstrate those skills, and those are skills that they are honing in addition to, of course, the clinical knowledge base. They're honing that oral, the communication skills that is needed.
Okay. Any 2 or 3 improvement opportunities that you may have seen consistently with IMGs as part of your interaction, what they should in general be working on, what you have seen they could improve on, anything that stands out for you?
Again, honestly, communication is a big part, and honestly, confidence in their in their medical skills. I think because the application culture may be very different in terms of it being a lot more objective from where they are in the manner that they have been trained, where there's a lot more objectivity and subjectivity, a lot more subjectivity that's involved from the U.S. training side. They need to be confident in their clinical skills. And from that, they can communicate, this is what I would do, this is what I'm thinking. So I have found that they have gained a lot more confidence and understanding and their ability to kind of integrate all of the information that they have.